name is Shauna Henderson. I'm a nurse practitioner, and today I'm going to be meeting with my patient, Mr. W, to discuss my findings of BPH with him. Come on in, Mr. W. How are you?
Doing fine. Yourself?
Great, thank you.
Glad to hear.
So, based on your symptoms and your lab work, it appears you have a condition known as benign prostatic hyperplasia, or BPH as we call it, and a mild urinary tract infection. The good news is it's not precancerous, it's not cancerous, and because your symptoms are relatively mild, it can be treated with medications and a couple of lifestyle changes. Do you have any questions at this point?
Yeah, that's some pretty serious sounding stuff. I mean, it's not something I can die from, is it?
No, it is not. Basically, it is when the cells of the prostate become enlarged. They increase in size and amount, and it causes the prostate to become enlarged.
Okay.
And it's not fatal. It's not anything you can die from. And because the prostate becomes enlarged and where it's located, it presses on the bladder. And so the symptoms you're experiencing, the urge to urinate, the increased urination at night, the feeling that your bladder is not completely emptying, is because the prostate is pressing on the bladder. And the urinary tract infection is because the urine is sitting in the bladder and not being released. It's kind of just sitting there.
Okay.
And that's where the bacteria grows. And you have
That
the
makes a lot more sense now.
Exactly. So the treatment plan for this is medication right now.
Just medication, nothing special, huh?
Not at this point. We will treat the urinary tract infection with an antibiotic.
Okay.
I'm going to prescribe Flagyl to you. You'll take it twice a day for 7 days.
Okay.
And finasteride I'm going to prescribe, which will help relax the prostate. And then Flomax 0.4 milligrams daily. That'll help increase the urine flow.
Okay.
So the finasteride and the Flomax, those will help with the urinary tract symptoms of the not feeling that you're completely voiding correctly.
Okay.
It'll help increase the urinary flow.
Okay.
We will follow up again in 3 months. If at that point we realize, or during that point you see that the symptoms are not getting better or they're getting worse, of course you will see me before that 3 months.
Okay.
And if at that point it is determined that the medication just is not working, then we can discuss possible surgical procedures.
Surgical procedures?
Yes. I don't think it will get to that, but those are just options to think about.
I mean, what exactly would they do? I mean, what
The most
kind
common
of
procedure is called a TURP. It's a transurethral prostatic resection. It's kind of a big term, which basically means the surgeon will put you to sleep and will go in and kind of remove some of the tissue of the prostate.
Going where?
Going through the urethra.
Wow.
But you will be totally knocked out. You won't feel
Oh,
the pain.
okay. That's not something I want to feel.
And then he will irrigate the bladder and drain the bladder so that it'll get out any excess urine that might be trapped.
Yeah, so you put water in and rinse it out.
And rinse it out,
basically.
yes.
Okay.
Exactly.
Yeah, a lot of times when I hear these terms, I don't, quite understand them, but that makes sense
Okay, good.
because I irrigate stuff outside. Put water.
kind of
Okay.
the same concept.
Awesome.
Different parts.
Yeah, a
however.
little bit different, but okay, I get it.
I took it upon myself to print up some information for you
Okay.
that you can review at home if you have any further questions or anything that we didn't cover today during our visit, as well as some websites that you can go to if you just would like more information about this.
Okay. Yeah, it looks like it's kind of broken down too, so I won't have to even hunt for stuff. I mean, if that's what I want to talk about.
Yeah,
That's
pretty much
all right.
we'll go into a little bit more detail of what it is, what it's caused, and it's a common problem that men ages 40 to 60 encounter.
Yeah. Lucky us, right?
Yeah, it's kind of part of the whole aging process.
Well, there's an alternative, and I don't want that, so I'll just
Exactly.
go ahead and go with this
So
for now.
this is kind of a minor, condition that,
Yeah.
like I said, can be corrected with medication. Lifestyle changes I would like you to make, kind of decrease your caffeine intake.
Oof.
I know.
One cup of coffee in the morning? Okay.
Try
But
to
Yeah, I mean, if I want to get better, I gotta at least try to,
cut it down,
follow.
not all together. Don't take it all away.
Yeah, because
Remove
people
it.
won't want to be around me if I cut it out altogether.
Right, and kind of decrease your spicy food intake, because those tend to irritate the bladder a little bit more. Again, you don't have to totally eliminate them from your diet, but just kind of cut back.
Oh, okay.
And
Alright.
try to avoid drinking any fluids 1 to 2 hours prior to bedtime, so you're not up having to urinate
Mm,
throughout the night until we get this condition under control. Okay.
okay. All right.
Any other questions?
No, I think actually you answered just about everything I needed to hear about it, and this looks like it's set up in a way that I could probably get to it in no time. Yeah, just go on the internet and grab what I need to grab off of it.
Great.
Thank you.
So, like I said, we will follow up again in 3 months and see how your symptoms are progressing at that time. Again,
Okay.
if anything gets worse, we will see you before then.
All right. Well, thank you for your time. I appreciate it.
Oh, thank you, no problem.
All right. Take care.
You too.
All right.
Thank you.